March is Colorectal Cancer Awareness Month, and even though the focus these days, of course, is keeping safe from COVID-19, it's also important to keep up with your colon cancer screenings.
In today's Eye on Health, Mikey Hood talks with a man who learned the importance of early detection because it may have saved his life.
I wasn't having typical symptoms, which is the scary part about colon cancer. After eating some bad food, and I thought nothing of it, but I knew this was not the normal situation when you would have, like, say, food poisoning, which prompted me to go have a colonoscopy to see what was going on actually.
What Don Jaffe thought was a very bad GI episode turned out to be something else. Something that Dr. Katie Farah with AHN says happens often and with no warning.
We don't really do anything major to cause colon cancer. It is a part of aging. Typically, most people develop polyps starting age 50, and polyps are precancerous lesions which can lead to colon cancer inevitably. So just the fact of aging predisposes us to develop colon polyps, which then inevitably lead to cancer.
Now, are there symptoms of colorectal cancer, things that maybe we should be looking for?
No, that's a great question. You know, patients often ask me this question, and really the most common symptom of colon cancer is actually no symptoms. Many patients are asymptomatic. And so while some symptoms may include abdominal pain, rectal bleeding, anemia, or what's known to be a low blood count, a lot of times patients don't have symptoms.
We didn't expect that result of colon cancer, so it came as a complete shock.
He ended up having surgery a week later.
You have to make sure you have a very good positive outlook, because colon cancer is treatable if caught in time. There's many different things that can be done.
Colon cancer screenings should be done by age 50 for white Americans and 45 for African Americans. And if you have a family history of cancer, by age 40, or 10 years before the age of a first-degree relative that was diagnosed. But many people are hesitant to get screened.
The fear of the prep. You know, that's what everybody always talks about, is the prep.
Preparation involves having to drink quite a bit of solution the day before to clear your gut.
You know, the prep is not the problem, because as long as you do that in steps and you follow what has to be done, you know, you'll be fine. And trust me, I've taken enough colonoscopies now to say that, you know, I'm a pro at it now. The procedure itself is not to be afraid of. I mean, you're in, you know, in the twilight, so you don't feel anything. There's no feeling at all. And within 30 minutes, you're out and you're awake and you're able to carry on the rest of your day.
We really try to educate patients in the office, as well as describe to them what could happen if you miss the screening opportunity. It's very heartbreaking when you diagnose a healthy 50-year-old man or woman who comes in for routine screening and they have colon cancer.
Now AHN has Saturday screenings to really help patients fit it into their schedule.
It is an opportunity where if you are unable to take a day off of work, and now during the times of the pandemic, if you're unable to obtain childcare, Saturday mornings seem to be the best time that patients favored it. And so we scheduled them relatively early.
I look back in my life 8 years ago to today and say, the things I would have missed kids' graduations. I would have missed, you know, one of my kids is in medical school. I would have missed, you know, trips to Europe and other things. They caught it in time. I was stage 2A, but forevermore, I have to check the box for cancer. You know, it's not like I didn't have chemo, I didn't have radiation, because I caught it in time. See a doctor immediately, because the more you delay, it only causes problems down the line. And if it is colon cancer, if you don't catch it in time, it only leads to other issues.
Wow. Good information there. Thanks to Mikey, to John, and Dr. Farah for sharing that important information that really could save a life. And we want to mention also that patient that you just heard from, John Jaffe, he is also an employee at AHN. So we want to just full disclosure there.
Yeah, I'm so glad he told his story, though, because the screenings are so important, and he makes the point. If you catch it early, it is treatable.
Yes.
So remember to keep watching for our Eye on Health series. It happens on Wednesdays here on PTL, brought to you by Blue Cross Blue Shield, together with Allegheny Health Network for your health.